Okay. All right, we'll go ahead and get started here. Just hang on one sec. Well, good morning, and thank you everybody for joining UNC Health for a media briefing via Zoom. So if we have a couple of technical difficulties, please forgive us. It's our first time using Zoom. Today's 30-minute call will focus on how UNC Health's hospitals' ongoing testing of coronavirus patients, how we're keeping our frontline staff safe, and other issues. And so now at this time, I'll turn it over to UNC Health's Alan Wolf, and Alan will introduce today's featured speaker. Alan? Oh, you're on mute, Alan. All right, let me unmute you. There you go. All right, let's try it again. Go ahead, Alan.
Hey, thanks. Dr. Amir Barzin is now incident commander for the Respiratory Diagnostic Center in Chapel Hill. He has had an illustrious career completing medical school at the University of North Texas Health Science Center, and then his residency at Family Medicine at UNC. Before the past month, he was medical director of the Family Medicine Center at Chapel Hill and UNC Urgent Care at the same location. Dr. Barzin, we talked a little while for a couple days ago, and you've got a fascinating story. I'd love to have you just talk a little bit about your role and what you've been seeing.
Yeah, I'm happy to do so. First off, thank you everyone for taking the time to talk to us. We really appreciate it from the medical community, knowing that a larger community is supporting us. We have been, over the past few weeks here, have been really working on trying to make sure that we're doing the best that we can to serve the needs of our community. When we first noticed that the spike in coronavirus was hitting, we wanted to get in front of it at UNC and try to find a way that we could adequately set up the ability to be able to do larger scale testing and then isolation and identification of patients who had COVID. So for the past 4 weeks now, we've been utilizing what we call our respiratory diagnostic centers that are set up across the area. Our location here is the one that is the largest one in terms of volume and throughput. We have what we call kind of like a drive-through model, where basically patients fill out questionnaires and then they come through the process, and we're able to assess whether or not a test is indicated and go from there. We have been working very closely with our lab, and Melissa Miller has been tremendously helpful in getting all this off the ground and has really done an outstanding job in being able to keep up with our demand here and then also for the state. But we're able to test people and get them assessed so that we know if someone has an infection at an early point, give us a little bit better idea of who that person is. We have secondary mechanisms in place where we are identifying and contacting those patients who are positive and making sure that they are looked at from a virtual perspective, at least daily. And that's been really positive for us to keep track of our community as well.
Great. Okay, so we can go ahead, and we'd like to use as much time as we possibly can for questions. So if you've got questions, please unmute yourself and jump right in and go ahead and ask. Let me see, make sure folks are able to be unmuted. I'm going to unmute everybody real quickly here. So everybody's unmuted. So if you'd like to ask a question, please go ahead. While we're waiting for folks to jump in, could you tell us really what it's been like for you on the front lines?
Yeah, I've been really lucky. One of the things that we have seen in terms of the mantra here at UNC is that there is an ability to really work together. So as a small example of that, our group that we have here is about 35 people. I had personally only worked with about 2 people that are on our site right now before all of this started. And it has just been an amazing experience to see everyone come together to work for the community and make sure that we're providing the best care that we can for our patients across the state. The team that we have here is just outstanding, comes in with a positive attitude every single day, works really hard despite the different changes that we have in weather. It doesn't matter if it's cold, hot, rainy, they're out there working really, really hard. And they're doing the best that they can to take care of themselves. I think one of the things that we're hearing a lot about, and my situation is not unique. I'm just reflecting on a personal experience. I have a 14-month-old daughter at home, and my wife and I, we went through the discussion beforehand, knowing that I was going to be here, how we were going to kind of accommodate that at home, because I didn't want to take a chance in risking bringing anything that to her from my workplace. So I've actually been kind of living in a separate section of our house, and haven't been able to really interact much with my daughter more than 6 feet away from her for the past month. And that's been tough, but I know that it's a small sacrifice that many others are making as well. We're just happy to be able to use our tools as medical professionals here to help the community.
So Lynn Bonner, you were trying to ask a question, I think. And
Yes.
Okay, I'll go. There you go. You're still on. You're good.
Terrific. Thank you. Thank you. I've got a couple of questions. Here's the
Sure.
first. Has the profile of people coming in changed since you started these 4 weeks ago? And I'm wondering whether you're seeing fewer mild cases since it came down that people should just stay at home if they get sick. And second, I'm wondering if your protocols on who gets admitted has changed since recent data has said that people of color are more likely to die from COVID-19.
Those are two really great questions. We're lucky, I think, in terms of the state of North Carolina of taking measures to do physical distancing a little bit earlier than we saw in terms of peaks in, let's say, areas like New York City or areas in California. The advantage there is that we have been able to identify people earlier in their disease process and be able to kind of continue to track them. In terms of disease severity of what we're seeing come through here, it's been pretty consistent. Most of the people that we have been seeing here have been having those milder symptoms, haven't been having a lot in terms of acute respiratory distress. But that's the nice thing that we have with being able to follow with people, is that we can kind of get ahead of that process if they start showing signs that they're not doing well, and route them accordingly to the hospital if necessary. And in terms of your second question, I think it ties into what we were mentioning with the first question. We're agnostic in terms of socioeconomic background, gender, race, in terms of who we're calling. If they're positive, they're getting a call every single day, and that's really important to us. We're treating everybody the same. And so we're making sure to keep a close tab on everyone, regardless of where they're coming from or other socioeconomic factors.
Thank you.
Hi, doctor. My name is Celeste Gracia. Can you hear me?
Yes, I can. Hi, Celeste.
Okay, just making sure. Hi, I'm from North Carolina Public Radio, and I have a few different questions. How quickly do people hear back once, like, they get tested, and then how long is the turnaround for you calling them to tell them whether or not they're positive? And on average, how many people do you test per day? And then lastly, how many tests do you currently have, and are you expecting any more? And if you are expecting more, how many more?
Thanks for those questions, Celeste. Those are all excellent questions. In the past few weeks, you may have seen some information that came out on the Today Show or articles that showed that Melissa Miller from our lab had developed a test that we are using here at UNC. We're very fortunate to have that availability for us. Fortunately for us, some of the stories that you're hearing about in terms of having a longer lead time to get a test result, we are lucky that we don't have to experience that right now. If we're testing someone, we're usually getting that result within either that same day or the next day. So we're really quick at identifying and don't have to wait the 7 to 10 days that some other patients and communities have to wait. In terms of the number of volume, in terms of the patients that we're seeing on a daily basis, we're testing anywhere between 70 to 150 people a day. It just really depends on the day and the volume that's coming in. Regarding the absolute numbers of the tests that are available, we're working really hard at UNC to get an excellent feel for our entire supply line. And we're working really hard to make sure that we can keep track of exactly where that is in terms of being able to divert resources from lower use areas to us if we needed to do so. We are very much in tune with what the state has been recommending, which is highest priority for testing are those that are in the hospital. And so inpatient hospitalized patients are receiving the highest priority when it comes to us being able to run our tests.
Thank you.
Dr. Barzin, did you want to talk about how we are following patients who have been tested through text messaging and MyChart, see how they're feeling?
Yeah, this was one of the things that's been very interesting during this entire process is the rapid speed at what we've done in terms of our virtual care options. So quickly into this process, we wanted to adequately be able to address the needs of our patients that were coming through the testing process. From that came a chat functionality that we have. So everyone who comes through our testing site basically is receiving a text chat that that's sent to them daily. From that process, if they are feeling worse, it actually then is flagged for a nurse to call that patient, regardless of their testing status. So this could be a person who had tested negative or a person who had tested positive. I'll talk about that part first. And then if it goes to a nurse and the nurse says that, well, it'd be really helpful to get another assessment from a physician, we can actually drop them into a virtual care provider visit as well. And that's been working really well for our patients who may just be wondering how they can best manage their symptoms, or at that point identifying early, well, this looks like someone who's having a little bit more difficulty in terms of respiratory distress. The second part that I mentioned briefly before is that in all of our positive patients, we're actually doing, we're not waiting for them to respond to us in a text. We're actually doing a more proactive approach where we're calling them every day, regardless of if they're engaging in that chat function or not. They like the chat function because of the ease, and we like it too. But we really are just trying to focus in on making sure that they're receiving attention, knowing that they're positive as well. And that has been very well received from our patients. And we're working that list every single day. And kudos goes out to the team of nurses that's been helping to do that. They've done a really bang-up job of making sure that patients feel really comforted and have their questions answered on the spot.
Great, thank you. Additional questions? Could you talk a little bit about, maybe while we're waiting for some more questions, about how what sort of the spirits of your staff are?
Yeah, it has been one of the most humbling and one of the most awesome experiences that I've had as a clinician. I told my wife the other day, I have never had a team merge together and be so enthusiastic and so positive ever in my career. I think that everyone here has been really working hard in trying to maintain each other's well-being in terms of being kind of a family away from home for each other. We've also seen a huge outpour of support from our community, and things such as simple as, for example, we had bagels brought in this morning for our staff from the community. That kind of two-way street of showing that the community is supporting us and we're supporting them, it really, really makes the staff do really well in terms of understanding that support system is there for people that they may not have ever known. And I think that makes it a really pleasant experience in terms of place to work. We're making sure that everyone is tended to and getting breaks if they need it. If they feel like they have any additional needs, we're addressing those as well. UNC has done a really excellent job of identifying support systems for people who may emotionally feel like they need some extra support. And that has been very helpful for everyone across the board in the healthcare system. So I think overall, this has been a really pleasant place to work. It's been a really fun place to work. And I can't imagine not wanting, when all of this is said and done, to take all of the people that I'm working with back to my own clinic and start having them work with me, because we've just developed such a great bond.
Great. We've got a number of media folks on the line. So if you'd like to ask a question, please just go ahead and jump in. Nothing, no waiting. And also, if you're having trouble with being muted, send me a message on chat, and we'll get you unmuted. Any additional questions?
Can I jump in with a quick question?
Yes, please.
You did a great job explaining kind of what happens toward the end of the testing process, the interaction with the patients. Can you sort of explain the nuts and bolts of the beginning when somebody shows up and what you do? And people need to have, do they need a doctor's note or prescription or some kind of indication from a doctor that they should be tested?
Yeah, we've been working really hard with having multiple avenues with our team at UNC into the way that people can get referred here to be tested. So there's a couple of really great avenues that we've developed. One is for physicians and providers here in the UNC system that see a patient of theirs that they see meets the criteria for testing, we'll be able to drop them onto our schedule so that the patient is notified that they have an appointment time to come and be tested, and then they kind of can go through the process of being tested. And I'll describe that in just a second. There's also this large development that we've had in the past few months with our virtual care center. And our virtual care center colleagues, if they see that a patient meets criteria for testing or they want an evaluation for their patients, because what we have said as a messaging part of what we want to do in terms of maintaining safety for our patients, but also addressing their needs, is respiratory related issues are actually getting routed to us here too. So that, you know, if someone has a cough, but they have a history of asthma, we're assessing them here as opposed to having every single individual clinic in the UNC system see those patients, so that we can hopefully try to localize any potential spread if that's the case. In terms of the process that we have here, it's kind of what you would imagine in terms of a checkpoint drive-through. We have a large circular loop. Basically, you kind of come around that loop. Going through the loop, you're registered for your appointment. You're given paperwork that we have matched up to coincide with what the CDC has recommended for people in terms of contact tracing paperwork. So it's a very easy replication to be able to report to the CDC. After that process comes through, you're directed to another tent where you get your labels for your paperwork, and you also get your lab labels. You bring that into the tent, and you then are reviewed. That paperwork is reviewed. You're assessed in the space of your car by one of our clinicians to make sure that we don't need to do a more focused assessment on you. And then in your car, you're swabbed as well. So this whole process that we're talking about, the circular loop that we have set up for our drive-through process, doesn't take more than a few minutes per person. And it's been really great to kind of see the efficiency increase as we've gotten more and more comfortable with it. And we do all of this while the person is remaining in their car.
Great, thank you. Oh, go ahead. Please go ahead.
Yeah, this is Celeste again. I'm just going to jump in. Earlier, you said that patients in the hospital are the highest priority for testing, and that you're following the state guidance for that. I'm wondering how soon, if at all, do you think testing will be more widely available for everyone and not just for those high-risk patients? Or is that something that is going to be up to the state?
Yeah, we're really leaning on our colleagues from the state. I think they've done an excellent job of laying out their recommendations and why the recommendations change. One of the things that we have been working through is that there's the point of where identification of every patient is helpful is if we were in a lower spread. Once we hit community spread, the state recognized that just a general recommendation for isolation, as opposed to saying everyone with symptoms come out to be tested, because what you do at times, if you say you have mild symptoms and you're not doing, and you're doing relatively well at home, it's actually a bigger risk to say come out to be tested, because then you could potentially, while you're in your car, you could stop at a grocery store and expose more people. So we've been really heeding the state's guidance on that. And so we will continue to do so if the ability for widespread testing is something that the state is going to recommend. We're happy to do it. At this time right now, I think we're seeing some of the benefits from our physical distancing guidelines that have been coming out in terms of hopefully trying to kind of flatten that curve that we've all been hearing about. So hopefully we'll see in the coming weeks if that reigns true. But yes, we're always on the day. There's never been a time that I can remember in medicine where I wake up every single morning to see what the state has recommended, because these guidelines are shifting and they're so fluid, because we've got such a nimble kind of environment that we're working in, and we always want to make sure that we're doing right by our communities and what's medically indicated.
And just to quickly clarify, which drive-through site are you working at?
We're working at what we call the Respiratory Diagnostic Center in Chapel Hill.
Oh, right. Yes, you said that earlier. Thank you.
Yeah. Mm-hmm.
Dr. Barzin, could you talk, you're interacting with patients as they come in to get tested for the first time. Can you talk a little bit about what you're hearing from them? Is there a lot of fear? Are they wearing masks? Are they, recognizing that this is a unique situation?
Yeah, that's a great question. I think that your spectrum is very wide there. I think for good reason, our patients just want some guidance and some help, and that's what we're here to do. Many of them are trying to practice, especially with the new guidelines that came out from the CDC. We are seeing more and more people wearing a mask, if it's even a homemade mask, as they're driving through, which is excellent to see. But I think that one of the things that they recognize is that we've gotten so much positive feedback about our staff being professional, courteous, addressing their needs. And that's really humbling and a great thing to see, that our community is thinking that the work that we're doing is meaningful to them, because at the end of the day, that's what we really are here to do, is serve our patients. And that's been the mantra that we've lived at UNC for a long time. So it's been really great to see the community responding the way that they have. And we've had the ability to touch base with people who are kind of leaning or tipping in the direction that we don't want them to go to. And when they do go to the hospital and they come out of the hospital, they send us messages that are really, really meaningful and impactful. And you would think just a 10-minute interaction with someone didn't make that much of a difference, but it truly has been wonderful to see that it does make that much of a difference.
Thank you.
Any final questions?
I have more questions, but I want to let other people talk if they do.
Hey, I have a question. Can you hear me okay?
Yep.
I can.
Okay, this is Elle Karis from WCHL. I was interested if you could touch a little bit more on, I know you said you were living in a separate, side of the house to kind of keep your family safe. I wanted to know more about you, and your fellow partners that you're working with, just some of the precautions that you're taking to make sure that, the spread doesn't go anywhere from inside the hospital to outside.
Yeah, we are doing quite a bit. So you'll see here, one of the things, I've got my mask right over here. When the CDC came out with their guidance, UNC was really quick to adapt, and we have a mask for all policy right here at UNC. If we're in a space that's closer than 6 feet with someone, we should be wearing a mask. I'm in a room by myself right now, and that's why I'm not wearing one. Other things that we're doing, we have hand sanitizing stations set up all over this facility, which is really, really important. We are practicing as much physical distancing as possible. In our morning huddle with 35 people, we stand in a circle the size of a parking lot. And that's one of the things that we do just to make sure that we are practicing as much physical distancing as we possibly can. When we're doing things that involve direct patient care, we're wearing proper PPE, and we're trying to make sure that we have monitors to ensure that people are wearing their PPE the right way. And if they're coming in contact with a patient, that they're taking off their gloves and disposing those and using hand sanitizer before putting on new gloves. So we're taking a lot of precautionary measures, and we're all looking out for each other. No one is faulting anyone to say, hey, I didn't see you sanitize your hands. Can you make sure to do so? And that's just on site. Personally, for me, when I come home, I have some disinfectant that's next to my door. Whenever I come in through the door, I wipe my handles off. I go straight towards the laundry room, take my scrubs, throw them in the washer. And the first thing I do when I get home is I shower before I come back into any area of my house otherwise. And so I think a lot of us are taking precautions like that. I know some of my friends have actually, colleagues in Charlotte, for example, has actually set up kind of like an outdoor shower area for their family members, so they know that that's not even coming into the house. So I think we're all taking precautions. We're all just being very mindful of where we work, and also being mindful of how we can best protect ourselves and our families.
Thanks for sharing that information.
Celeste, you had some more questions? We can wrap up.
Thank you. Well, kind of to piggyback off that last question, I was going to ask about PPE and how much you feel like you have, you and your team. But based off what you just said, it sounds like you guys do have enough, and you're not having to recycle any equipment. Can you talk a little bit? I'm asking because we do hear in some other places that they're asking to reuse it or recycle, and I just want to make sure that's not the situation with you.
We're working very closely with our infection control department to make sure that the PPE that we're using is adequately used. And we are using extended use PPE. So we are making sure that we are very careful about the way that we're using our PPE. And if we can, one of the advantages that we have is that by keeping people in their car and we're in an outdoor area, the risk of aerosolization is lower. And so that's a nice process that we have set up to make sure that what the PPE that we're using is being able to be used for an extended period of time. Again, our infection control department has been really revolutionary in trying to find ways that we can sterilize things like N95 masks for reuse. We've been really lucky at UNC to have a great community drive that has brought forward a lot of masks for us. And so thank you to everyone in the community who donated N95 masks, gloves, etc., because it's made a big impact for those working on the front lines. So we are trying to, again, be as cautious and as mindful. We're trying to be really good stewards. The same thing we're telling the community we are living every single day. We want to be really good stewards of PPE and make sure that we're trying to get as much use out of it as possible. I always tell my staff that if we practice doing the things that we should be doing every single day, we're in a very safe environment as long as we're being very mindful of how we're using our PPE and making sure that it's being used for as long as possible.
Thank you.
Great. We're almost out of time. Any additional questions from anyone who hasn't asked a question, or from folks who have? Either way. That it? Okay. Well, thank you everybody so much for joining us. We really appreciate it. We're doing this in an effort to try to keep the community informed of what's going on and to provide news sources for you. If you have additional questions, please let Alan Wolf or myself know. You can email us, text us, give us a call, and we're more than happy to work with you. That's why we're here. Dr. Barzin, thank you so much for joining us today. And we know you're super busy, and we really appreciate the availability.
Yeah, it's a pleasure. Thank you, guys. Thank you, everyone.
Great. Thank you all for joining us, and we will more than likely keep to our schedule and have another briefing on Monday. Thanks so much.
Thank you.